For the American Council on Science and Health, I'm Anna Samovska with your news. Two pharmaceutical companies have decided they will cut down on their prices on cervical cancer vaccines for some of the world's poorest countries in an effort to help girls get vaccinated. Merck, the second biggest U.S. drug maker, has spent several years testing programs in Rwanda, where 95% of young girls have received the standard 3 doses of the HPV vaccine. Compare that to 1/3 in the U.S. The companies plan to sell their vaccines to low-income countries for about $4.50 per dose. That's a 95% discount. Here's some perspective from ACTIA President Elizabeth Whelan.
Now, in the United States, we don't worry a lot about cervical cancer because we have very good screening and very good early treatment should it occur. This is not the case in many developed countries. Indeed, it can be the leading cause of death among women. So to have an HPV vaccine available at minimal cost is really good news.
And for more on that story, head to our website, hsdispatch.com. In other news today, we hear it all the time, a possible flu pandemic. Some say we may even be immune to that threat. But is it real this time? Researchers at MIT say yes. A new study says that current flu vaccines may not be effective against some virus strains that currently circulate in animals, but they are very similar to the 1968 Hong Kong flu, which killed approximately 1 million people worldwide. Now, the good news is that some strains are less harmful than the seasonal flu, but the team is conducting more studies to figure out which ones could be dangerous. And now for your Friday funnies. Here's a funny idea, a pair of underwear that can sense when a person smokes. Oh, it's real, and the University of Alabama received $400,000 in grant money to make this idea a reality. The money was used for 2 studies. Individuals were fitted for the garment, and this picture here shows a cigarette tracker. With the help of a breathing sensor put in underwear, it tracked their daily physical activities and eating and smoking. The goal was to determine whether this sensor underwear could detect cigarette smoke. I don't think that here at ACTIA we will be getting fitted for those anytime soon. And for more on those stories, check out our website, hsdispatch.com. I'm Anna Samovska for the American Council on Science and Health.